Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. It's a 30-minute daily update on the coronavirus pandemic in Nigeria and across the world. First, some of the highlights. Today, new cases of COVID-19 recorded across 8 states except Lagos, more cases in Kano. Edo State embarks on community screening. And Mauritania records no new virus cases after recoveries. Still more cases been recorded in Nigeria as the Nigeria Center for Disease Control (NCDC) confirmed 38 new COVID-19 cases. And for the first time, Lagos did not record any new case of the virus. 23 of the cases are in Kano, 5 in Gombe, 3 in Kaduna, 2 each in Borno and Abia, and 1 each in Abuja, Sokoto and Ekiti State. This brings the number of confirmed COVID-19 cases in the country to 665, with 188 patients discharged and 22 deaths recorded. Now take a look at the state-by-state breakdown of the cases, which showed Lagos with the highest number, followed by the FCT and Kano, third highest. Now here in Lagos State, there are no new cases of COVID-19. However, coronavirus-related deaths have been recorded in the state. In a tweet earlier today, the Commissioner for Health, Professor Akin Abayomi, says a 45-year-old Nigerian male who returned from India in January and a female with severe underlying health conditions with no history of travel or contact with any COVID-19 confirmed cases have died. Latest figures of COVID-19 cases from the Lagos State Ministry of Health shows that the total number of confirmed cases is 379. The number of active cases, 260. Total discharge is, of course, the number that you can see there, 98. Total evacuated, 2. The number transferred is 3. And the state so far has recorded 14 deaths. The state government is asking residents to remain vigilant and report any concerns about COVID-19 infections in Lagos communities. Well, joining us for more on efforts to containing the COVID-19 pandemic is Dr. Anne Okoma, a public health physician. We'd like to thank you for joining us on the program.
Thank you, Millicent.
First, tell us what we're seeing, what appears to be a trend now, more cases in Kano especially.
Yeah, so right now what we're seeing in Kano is an ongoing community transmission. And at this point, the government of Kano will have to do a lot with regards to community engagement. We know that people in the north usually live in clusters, and most times they live in small settlements of clusters. So at this point now, the government would need to engage the people that they would listen to,
so
the traditional leaders, yes, their community leaders, their religious leaders. The government now will have to aggressively start a community sensitization there, and also start maybe an active case surveillance there, so they don't have to wait for the situation to escalate more than this, because I don't know if Kano will be able to handle the situation if it goes any worse. When
we talk about expertise in terms of health workers, do you think they can handle it, especially health workers that are spread across other states?
Yeah, you know, in the north, they don't have enough doctors there. So it's going to be a very big problem. So what they need to focus on right now is prevention. And that is the reason why the government will have to do a lot in terms of prevention. So having to educate the people using the channels that they would ordinarily listen to.
Now, we're also witnessing a higher number of deaths in Lagos, and some would argue not so much compared to the global community. But then what is happening in Lagos? We know that some of these cases, the patients are said to be having underlying causes, but what is it with this virus that, you know, it appears to attack so much, and, you know, we're losing a number of people?
Yeah, for Lagos State and with the coronavirus, I think what we're beginning to see now is a community transmission, first of all. And For most of the people, number of cases of death that we've had, they've all had underlying illnesses, and then maybe people who had hidden the truth about their history at some point. So for Lagos State right now, it still comes down to trying to get the message across. Because like we all know, it's novel, so research is still going on. And from people who have been infected, from stories that we've heard from the survivors, you will see that most times when they came in contact with this virus, they didn't even spend up to 2 minutes. Just 1 minute is enough. So the situation is very tricky, like I've said before, and we now have to maintain very high index of suspicion always. So we have to now, at this point, take preventive measures very seriously. Now, the government is saying, yes, they're going to start ensuring that everybody uses a face cover, and then, but at the same time, we also have to observe social distancing and all other precautionary measures like hand washing and the rest of them.
So far, do you think that is working? I know we have the lockdown in Lagos, the federal capital, and then Ogun State.
Well, the active case surveillance, we've been able to fish out people, but for the stay-at-home order, it's really disheartening when you go out there and then the number of people you see on the roads. Even getting here, I got into a traffic, getting to the studio here today, and you see that a lot of people really do not understand what this virus is about. They just feel like, oh, this is some avenue for the government to just, you know, enrich themselves and all that. And what we're saying at this point is that this thing is real. What you're seeing now, people are being infected every day. So people need to really take this stay-at-home orders. Yeah, there are a lot of sentiments, a lot of issues have been raised with regards to security, palliative, Nigerian being an economy that lives from hand to mouth and all that. How are people going to survive? So it has to be a two-way thing. The government taking responsibility in some part, and then the people also taking responsibility in some part.
All right, we're just being told our correspondent from the Federal Capital Territory joins us now, Terry Kumi. Terry, how are you doing today? I hope you're staying safe. Tell us about compliance levels in the Federal Capital Territory.
Well, hello, Millicent. Thank you for coming to me. First of all, let me just give you an update. The Federal Capital Territory Administration has reported that as at 11 p.m. yesterday, one new case was discovered, 11 people discharged, and one death recorded. We also hear that according to the FCTA, the breakdown for the FCT is 89 confirmed cases, 51 active, 35 discharged, and 3 dead. The FCT Minister for State is continuing the distribution of palliatives to the 600,000 identified households in the FCT with Kuje and Kwali today. And one thing about the compliance level is that the mobile court is in full effect. And yesterday, the FCTA reported that 66 people were convicted and sentenced to community service, and a fine of 1,000 naira was imposed on them, as well as compulsory attendance of lectures of the COVID-19 pandemic. And coming to the compliance level now, the situation in the FCT is not entirely pleasant. Some of the messages I have received suggest that some people are getting carried away with the fact that the FCT is not recording high cases like Lagos and quite recently Kano, despite the commencement of the community active case search. And it does seem that there's been some sort of reset from the lockdown when it was first announced almost 3 weeks ago, and quite a number of vehicles are on the road. There's an increased number of pedestrians, and there's been a decline in the number of security personnel on the road. What's even worrisome right now is that the satellite towns like Kubwa, Gwagwalada, getting access into the city center is quite difficult and has resulted in very high traffic along the airport road and Kubwa road. And sadly, the people most affected are those on essential duty who are compelled to sit in that traffic with those who are not supposed to be on the road.
You two quickly tell us about the policy in markets opening and closing in Abuja.
Well, in doing my own monitoring, I have observed that there's a need to question the rationale behind the new protocol of the FCT, which allows markets to stay open on Wednesdays and Saturdays from 10 a.m. till about 4 p.m. The initial protocol was for markets to be open on Mondays, Wednesdays, and Saturdays before it was revised. Now, you would also need to question the effectiveness of the lockdown with this new protocol. You find hundreds of people clustered together on these days. Thousands in some big markets like Gariki, Wuse, and Utaku market. And in fact, if you go to Gwagwalada, there's only one market there. And everyone troops in there at the same time and makes it even more dangerous than leaving the market open all week for people to go at random. So the market protocol for the FCT is quite worrisome, especially at this time where there are increased worries about community transmission of the virus.
Right, many thanks, Terry Kumi, our correspondent there from the Federal Capital Territory. And, as we let you go, fact or fiction, when it comes to face masks, what are we supposed to do? The local face masks, will they be effective in curbing the virus briefly?
The local face masks are going to serve as a barrier. So even if we're going to wear them, we still have to observe social distancing. Yes.
All right, we appreciate your time. Public Health Physician Anna Koma, thank you for joining us.
Thank you.
Now, the palliatives for COVID-19 in Delta State is certainly not going around yet, and some residents of Abuja and Sapele local government areas are calling the attention of the state government to be part of the beneficiaries. But the state government is giving assurances that the needs of the poor and vulnerable will be met at some point. The Speaker of the Delta State House of Assembly led the team to distribute some relief materials.
The lockdown in Delta State has continued to bite hard on many residents, especially those in the remote areas and rural communities, with a clamor to be a part of the palliatives that is being distributed by the state government. Some homes we visited had these people who depend on day-to-day activities to feed, asking the state government to come to their aid.
They pay for body with my children them. Nothing. Since 1 month when I talk them, no, I need to work. My husband done late. I get 10 children with me, 11. Nobody help me. I not get help. Nothing. Now can't they pick they say?
I'm agree. I'm not feeling happy. We are suffering. So I need the government to take care of us. Like what they said, that every month or every day we need refreshment. But like now, I have all 6 children.
Help has finally come their way with the distribution of these food items from one local government to another to ensure that the people who need them the most get them.
The items are properly distributed because the people are just thinking that it's for everybody. It's not for everybody. You understand? It's for the vulnerable. So it's clear, and we have told them too that it's for the vulnerable. So when some people are already working, and the people are on appointment, they are requesting for palliative, and it's so sad for that. And we have insisted that these items is for the vulnerable.
As the lockdown continues with extension for another 2 weeks, some residents who are yet to get these palliatives are hopeful that it gets to them, even as they try to comply with the directive. From Asaba, Vivian Oramadike, Channels Television News.
Abia State government has approved the operation of COVID-19 mobile courts in Aba, Umuahia and Ohafia to try offenders. A statement signed by the Secretary to the State Government and Chairman, Abia State COVID-19 Committee, Mr. Chris Ezim, says lockdown is still in force in Abia State and urged all and sundry to remain steadfast and committed in the fight against COVID-19. The government is asking citizens to cooperate with security agencies, state and local government enforcement teams as they implement the lockdown order in the state. It also solicited the understanding of all as it continues to roll out palliatives to cushion the pain and effect occasioned by the lockdown. According to the government, all motor parks and markets are to remain closed during this period as security agencies and enforcement teams have been instructed to impound and confiscate any intercity passenger vehicles leaving any park or around the borders. Edo residents have been advised to make the most of the screening exercise ongoing in designated healthcare centres to know their status regarding the virus. The Edo State Government has provided 10 healthcare facilities in 6 primary healthcare centres and 4 private hospitals for screening in Oredo local government area. Speaking to Channels Television, the Deputy Director of Nursing Services of the Oredo Primary Healthcare Centre says the screening exercise, which started on Friday, has seen a decent turnout, adding that no person has been referred to an isolation centre so far. Meanwhile, members of the Hausa community in Edo State are being told to obey the state government's directives designed to curb the spread of the pandemic. Leader of the community in the state, Mr. Badamasi Saleh, who distributed face masks among traders on Lagos Street, as well as beggars on Mission Road, both in Benin City, the state capital, advised them to strongly follow rules for their personal safety and that of others. And we have more states taking measures on preventing the spread of COVID-19. We begin in Plateau, where 43 passengers coming from Lagos are currently in isolation in Jos, the state capital. The passengers are said to be 48 in number. They were arrested in a Kwanga local government area of Nasarawa State while trying to pass through Lafia to Shandam in Plateau State. Their insistence to pass through Lafia, the state capital, led to their arrest, after which they were taken to Jos by some security personnel. On the way, it's reported that 5 persons escaped, leaving the number to 43 who are now in isolation. Sokoto State has recorded its first case of COVID-19. The governor made the announcement after briefing from members of the state's task force against the spread of COVID-19 in the state. According to him, the index person is receiving treatment at the Usmanu Danfodio Teaching Hospital at the moment, and says the case has been confirmed. He will be transferred to the Sokoto State Established Isolation Center in Amanawa. In Katsina State, the government said the lockdown on movement of people will take place today, will start today, that is, the state capital, and that it will also cover Batagawarawa, and that's the local government area close to Katsina due to its proximity. Governor Aminu Masari said this when he received the DG of the NCDC along with the country representative for the World Health Organization. In Ogun State, in a bid to contain the possible spread of the virus, the state government released about 249 inmates across the state. Conducting the special jail delivery exercise in Abuja, the chief judge said it is the imperative or order to decongest the centres. And finally, Cross River State Commissioner for Health is appealing to the federal government to indeed support Cross River in the fight against the pandemic. At a press briefing in Calabar, Dr. Edu stressed on the fact that the state is in dire need of testing centres so as to ensure maximum utilization of increased testing capacity. We take a look more into the efforts at flattening the curve as we see here in Nigeria. Joining us in the studio is a public health physician, Dr. Olorunfemi Oluwaseun. We'd like to welcome you to the program.
Thank you. Good afternoon, everybody.
Now, looking at the spread of the pandemic, individual and then institutions, for families, how bad are things going to get, and what do you think families should be doing to be prepared?
Just like the governor said yesterday, the governor of Lagos State, most likely things are going to get worse before they get better. The reason being that when the community spread, state of community spread right now, and you don't know who is infected, who is not infected, and you see people moving about, even breaking the lockdown rules. So he sees that even from when the second phase of lockdown was instituted, I think we had double the amount of number of cases we had in Nigeria during this just 1 week. Tells that things are probably going to get worse before they get better. And as families, we should prepare ourselves for things getting worse. I mean, that you have to have an emergency plan in place, that we should keep things in such a way that if anything does happen, we can survive. And the key things we have to look at are our health, food, water, and our security. We've known what's happening on social media. People should about security. In the health case, we have to, as individuals and as family, we should have somebody, a primary care physician. That's somebody that knows you and knows your family, not just somebody you pick on random, this is my doctor. No. A primary care physician, somebody that knows your history very well, that if you pick a phone and say, this is what's happening to me, can give you appropriate direction as to what to do. Also, as a family, you should have at least 2 weeks supply of food at home. Usually canned food, dry foods, if you have perishable, and if you have access to electricity that much, perishable can about 2 or 3 weeks store. My friends on social media laugh at me because I said I isolated 2 chickens in my flat. That is to provide me proteins during this period, so that in case I couldn't get access to the things, I could buy meat or fish, I could kill those ones. Then also security, you need access to media with authentic news, not the ones that go on social media without confirmation. Media that give you authentic news, what's happening in your environment, what's happening nationally, state level, everywhere like that, then you need something that keep you safe. Of course, your security door, touch lights with working batteries. So it's not that when lights goes up, you now start looking for what to do about the place. This thing must be ready at all times within your house, even beyond this pandemic itself. Because emergencies, as we said, are not planned for. And there are plenty kinds of emergencies. This one is taking us stay at home or stay in place. There are others you have to evacuate your family from a particular place. There are some that can catch you within a facility, which goes institutional preparedness now. As institutions, corporate bodies have clinics in place. That's a staff that is skilled enough to be able to manage these things that are there.
Yes, but still on, talking about community level, with that we hear the pandemic is spreading. We already have existing healthcare systems that have been said to be weak. And when you look at it across Nigeria, we're facing a problem.
At community level, that's where public health comes in. Primary health care is when people take possession or take responsibility for their health at that community level. The PHC system is such that you have a private healthcare facility per ward. And in that ward, they call the CDC, which is responsible for managing things that are faced in their ward. There's a ward, there are health personnel and things like that that helps you to be able to take responsibility for your health care. These people are supposed to be primary frontline people right now because they are supposed to know who are the vulnerable people in the community, the elderly, the aged, the differently abled people, those living alone. Those are the people that you say that they are vulnerable right now because they may not be able to access other things as soon as possible. They are supposed to take responsibility for the primary health care in their ward to make sure that it's accessible at all points in time, not just physically accessible, financially accessible for people, and also stocked to thereabouts. We are talking about PPE right now. There are other levels of health care I'm not talking about. People at other places, people are dying out of pre-existing diseases, diabetes, hypertension, cancers, because they are being turned down from facilities. So there was a man in the US that was turned down from 70 facilities before he got one. And that man had a pre-existing condition. We don't want to get there in Nigeria.
All right. We'd like to thank you, Dr. Lauren Femoluashenwo, public health physician. Thank you for joining us on the program.
Thank you so much.
Now, authorities in Mauritania say the country does not have any active case of coronavirus as of today. The West African country has in the last 2 days been conducting tests, but none had turned out positive. Mauritania confirmed its first case of the virus on the 13th of March. A week later, the country imposed a night curfew and banned international flights. Meanwhile, the World Health Organization is warning international community that rushing to ease the coronavirus restrictions will likely lead to a resurgence of the illness. The Nigeria Center for Disease Control says to remember face masks are to be worn in combination with social distancing, hand washing, cleaning off surfaces regularly with disinfectants. The website has all the information, statistics on the cases across states with regular updates. Also, the World Health Organization rolling updates on the pandemic. It also has strategies and plans each moment. It keeps updating on the number of cases, the number of deaths, and the recovery efforts across the board. Well, that's our COVID-19 update at this time. We'll be back with another update at 6 p.m. Do join us then. I'm Millicent Walker. Thanks for watching.